I want to take a moment and thank you for watching our technique video. This is Dr. Richard Ma, and we will be presenting our arthroscopic technique for a lateral meniscus repair. The author and I do not have any relevant disclosure for the purpose of this presentation. The meniscus repair typically starts with mechanically preparing the surfaces for the repair. Because these tears often travel through segments of the meniscus where vascularity may not be optimal, we do take a lot of time rasping and preparing the tear surface as well as the adjacent synovium prior to the repair. Once the posterior lateral counter incision is made and the speculum in place, we then place our first vertical rebar suture tape in the posterior aspect of the radial tear. A second vertical mattress rebar limb is then placed just 5 millimeters anterior to the radial tear of the lateral meniscus in inside-out fashion, similar to the first posterior vertical limb. Once the two rebar suture tapes are in place, we then place a horizontal mattress just outside of both vertical rebar suture tapes in inside-out fashion. Depending on the depth of the radial tear, you usually can place 1 to 2 horizontal mattress inside-out meniscal suture tapes. Usually there's an opportunity to place an all-inside horizontal mattress, which is being demonstrated here using the meniscal scorpion. While we recognize that healing in this most inner zone may be unpredictable, this additional stitch may protect your more peripheral mattress sutures from gapping with early knee range of motion. The sequence of tying the meniscal suture tapes typically begin by tying the inside-out vertical rebar limbs first. Following that, we then typically tie the horizontal mattress inside-out meniscal suture tapes. What's being demonstrated here is typically the last set of suture to be tied, which is the one on the most inner portion of the lateral meniscus. This is where the passport cannula, as well as good suture management, is important, so that these can be tied without entangling the sutures. We typically get this tied with 5 reverse half hitches to secure the repair. We've had some anecdotal evidence where we have gone back in to assess these radial tear repairs and have not seen any knot abrasion on the chondral surfaces for these small meniscal suture tape knots. This is now showing the completed radial tear repair with a good approximation of the radial tear edges following the repair. We finally complete our meniscus repair by placing several microfracture vents around the endocondyle notch. This typically causes a fairly robust bleeding and egress of bone marrow elements into the intra-articular joint. Hopefully this bleeding creates an environment that would be conducive to healing in these difficult radial tear repairs. We want to thank you for watching our technique video. We also welcome any questions or comments regarding our arthroscopic meniscus repair technique.